Hi everyone, and welcome to another episode of Catching Up on the Couch. I'm Christine Matelan, Head of Operations for Advanced Rheumatology, and our forum today is going to be open enrollment for the benefit year of 2022. And today I'm joined by Cody.lott. Welcome, Cody, insurance agent and financial advisor. So, Cody, tell us a little bit about yourself, where you work.
Hi, Christine. Thank you for having me today. I work with Bankers Life and Bankers Life Securities. So as Christine said, I'm an insurance agent and a financial advisor. And really what I help people with is protecting their entire retirement, whether that's through financial planning or through Medicare. Especially this time of year, people have a lot of questions. And that's what I'm here for, is to help guide you guys through the process to put you in the best place possible for your retirement.
Okay. So I just want to play a little game here called Medicare Myth or Fact. And just so our audience knows, some myths that they might think are actually Medicare facts. So the first one is that Medicare costs the same for everyone. Myth or fact?
That is a myth. The cost of Medicare, that's going to vary person to person. Some individuals may pay a standard amount, which last year was $148.50. It's going to be going up to $170.10. However, that's going to depend on the individual. Some people pay upwards of $400 or $500. Some people may be paying nothing. So that is definitely a myth that everyone pays the same.
Okay. What about Medicare covers everything, including prescription drugs, dental, vision, hearing, fitness, coordinated care, transportation to office visits?
That is a myth as well, depending on if you're on a Medicare supplement or an Advantage plan. That's going to depend on the benefits that you're able to receive. And there are different cutoffs with that depending on which plan you're on. So that's a myth that every plan covers everything.
Okay. What about at age 65, you're automatically enrolled in both Parts A and B?
That is a myth as well. So when you turn 65, it's important that you sit down with a professional to talk about your Medicare situation. You do have to take action at 65. If you do not, sometimes you can be penalized for that. That is a myth.
Okay. All right, so just a couple of starting points there. And we'll end with one more. You can enroll in Medicare whenever you want.
Unfortunately, that is a myth as well. There's certain enrollment periods that you have with Medicare. So typically 6 months before you turn 65, you want to sit down with someone to look into what you should do as far as enrollment. Most of the time, you need to plan in advance for that. You can't wait until you turn 65.
Okay, so Cody, let's begin with just a brief history of Medicare.
So Medicare was actually introduced in 1965 by Lyndon B. Johnson and his administration. So over the years, Medicare has really changed and developed. So back in 1965, we had Part A and B. Over the years, though, starting in the 70s, people that are not only 65 are able to be on Medicare if they have special circumstances with their health. Over the years, we've had Medicare supplements being introduced, which we call the old Medicare. And now we have the new Medicare with Medicare Advantage plans that offer a lot of these extra benefits that people see.
Okay. So the difference between Part A is hospital services, correct?
Correct.
Does that hold a separate deductible from your Part B, which is your outpatient physician visits, laboratory tests, x-rays, etc.?
Correct. So Part A is your hospital stay. I like to keep things simple when I explain Medicare. So Part A is what I call your room and board when you're in a hospital. So typically you're going to pay $14.84 to be admitted into the hospital under Part A coverage. That does cover skilled nursing care as well in a very limited capacity. So your Part B, that's a little bit different. With
Okay.
your Medicare Part B, that covers medical treatment. Anytime you go to see a doctor, any treatment that you receive at a doctor's office is covered under your Part B. Now, for Part B, that works a lot like private insurance that people are used to. Medicare is going to pay 80% for you, but you're on the hook to pay 20% if something happens.
Okay.
So your Part B deductible has gone up this year from $205 actually to $233, we just found out.
Okay. Part C?
Mm-hmm. So your Part C, that is your Advantage plans. So under your Advantage plans, that's your private insurance, your Medicare Advantage that you're able to get with a lot of the extra benefits. That's where people have a choice. So under your Part C, you can either go the traditional route of just keeping A and B and looking at a supplement, which we'll talk about with the different letters, or you can get your Advantage plan, which is going to include your dental, vision, transportation benefits. However, when you do get onto the Advantage plan, that's a managed care plan. So you're in a network of doctors and you have certain limitations with that as well.
Okay. And Part D?
So your Part D, very simple. D for drugs, I always tell people. Part D, that is going to vary person to person, the cost associated with it, similar to your Part B that we talked about. So under your Advantage plans with Part D, that's included in most Advantage plans. However, if you go the supplemental route, you have to pick up a separate Part D prescription plan.
Okay. And then there are optional supplements, I believe, and please correct me if they've changed for 2022, F, G, and N. Are they all still available?
Yes and no. So you're correct. Plan F, actually, at the end of 2020, if you're new to Medicare, you can no longer enroll in Plan F. There's a few differences between Plan F, Plan G, and Plan N. So with your Plan F, that's going to cover all of your medical expenses that's not covered under Part B. Okay. That's going to pick up the additional costs. And with Part A, that's going to pick up the hospital coverage as well.
Okay, but that's not available anymore. So anyone over 65 that has that should probably try to keep it?
Under most circumstances, yes.
Okay.
Part F doesn't exist anymore for new people that are new to Medicare. Under Part F, one advantage that you have with it is you don't have your Part B deductible. So that is covered with your monthly premium to the specific carrier that you're with. So you don't have that $233 deductible that you're responsible for.
Okay.
Now, under Part G, you do have that deductible of $233 you have to meet before Medicare, before your private plan kicks in to start covering for you. After that, you're not going to have any co-pays when you go to the doctor's office. Plan N is a little bit different. It's the most cost-efficient supplemental plan that's typically offered in our area, which may be great for some individuals. The difference that you have with that is you still have your $233 deductible. However, if you see a specialist, you're going to have a $20 copay. And if you need to go to the emergency room, you're going to have a $50 copay.
Okay.
As well as if you're traveling out of state, Pennsylvania is one of the few states that does not allow an excess charge on the Plan N. So you might want to keep that in mind when traveling out of state.
Okay. So unfortunately, in rheumatology, most of our drugs are extremely expensive. And it's fine when a patient is between the ages of, 18 and 64. A lot of companies provide copay cards. for the drugs where they pay $5, $10, $20, $50 a month for their medications. Once they turn 65, of course, these cards no longer apply to them because they consider the patient of Medicare age, and Medicare is considered government insurance, and copay cards do not apply to government insurance, which would be Medicare, Medicaid, TRICARE, and am I missing any others? I believe those are the top 3 government plans.
You are correct, yes.
Okay. If a person decides that they want to work beyond 65 and not go on Medicare, are they penalized?
So if somebody is turning 65 or beyond the age of 65, typically I recommend that they enroll in Part A for Medicare. That they do not have to pay a premium for. If an individual has worked at least 40 quarters or 10 years, Part A they've paid into their entire lives, they want to enroll in Part A.
Okay.
However, oftentimes, depending on the cost of their employer plan, they want to defer Part B, and they will not incur a penalty for that whatsoever.
Okay.
As long as they have credible medical coverage, you can defer Part B until later.
Okay, so what about those patients that are 65 or older and they have their Medicare A, B, and D, but now they have unfortunately been diagnosed with, something very life-threatening where their medications are going to be very expensive. And there are patient assistant programs out there for most drugs. We encourage our patients to check them monthly. They're located on our website under resources. But now they need expensive medicine, and they're thinking about changing over from A and B to A and B and a supplement. Are they going to be penalized?
So if an individual is just on Part A and Part B and does not have, as we talked about, a plan F, G, or N, if they do have something that's more serious or life-threatening, they would be subject to some underwriting, switching over to a supplement. So a lot of times they would have to enroll in an Advantage plan. However, if they're already on a supplemental plan, it's usually advantageous for that individual to stick on that supplemental plan. They can oftentimes get additional help, as Christine mentioned, from manufacturers for their drugs. But that's when we get into the donut hole a lot of times with prescription drugs, which can get a little bit complicated for individuals when your payments are going to vary month to month. That's one of the first shutoffs that we have with Medicare, that unfortunately a lot of times we have to work with these assistance programs to be able to help individuals meet the cost of their drugs.
And if they're on in Western Pennsylvania, we have, multiple carriers for Advantage plans. If they're on an Advantage plan now and decide that they'd rather have A, B, and a supplement, penalized for that switch?
No, they would not be penalized switching from an Advantage plan to a supplement or vice versa. The only question they have to look into is, will they qualify for a supplemental plan? When an individual is turning 65 or they're new to Medicare, meaning that 6 months before they turn 65 or 6 months after they turn 65, they can automatically enroll in that supplement. But if they want to change from a supplement to an Advantage plan later on in life, there is no penalty associated with that.
Okay. And my mind tells me that, say for instance, I developed rheumatoid arthritis, severe rheumatoid arthritis, where I needed to be on a drug that's infused. My mind tells me I want to be on Medicare A, B with a supplement. But what if I develop high blood pressure and I need to be on an oral medication? I would probably want to pick up a Part D plan as well for my over-the-counter medications.
Correct. So when you enroll into Medicare, when you're new to it, it's very important that you're enrolled in an Advantage plan that includes drug coverage, or if you're on a supplemental plan, that you pick up a Part D prescription plan when you turn 65. If you do not pick up a prescription plan when you turn 65 or are new to Medicare, you're going to get a penalty that will last the rest of your life.
Okay. And what about these television commercials, you know, where they quote a certain price and it's going to include dental and vision and drugs and rides to the doctor, and, you know, everyone is on a budget no matter how much money you have. You know, everybody tries to be costly, especially when turning 65 and you're looking at the longevity, you know, of you and your spouse, or, you know, you have children in college or whatever it may be. Cheaper is not always better, correct?
Correct. So with Advantage plans, there's limitations to the benefits that they advertise. A lot of the carriers try and tell us that their plan is the best, that they're going to have a lot of extra benefits. That's a myth. There are extra benefits that you can get with these plans. There's limitations that you can receive. Sometimes those extra benefits that you have are amazing for individuals, but for a lot of individuals, they may not use them, and it's not always the best fit for them. The biggest thing is with Medicare, it's not one size fits all. It's not a cookie cutter program.
Okay, so we discussed dental and vision. You always want to make sure that that's included. If you're just doing Part A, Part B, and a supplement, you want to make sure that you have separate dental and vision, because your supplement is not going to cover the dental and vision, correct?
Correct. So you do not have vision or dental coverage or prescription coverage included with your supplemental plan. You absolutely have to enroll in a prescription plan when you're new to Medicare, because you won't have your prescriptions covered, and you will face a penalty even if you're not taking prescriptions and you go to enroll later on. As far as vision and dental goes, you do not have to enroll in a vision and dental plan. However, it's very beneficial for you to cover those out-of-pocket costs that you have. So we would have to look into a separate prescription, dental, and vision plan when you go the supplemental route. It's more of a la carte program with the supplement.
Okay. So I guess some important questions that our audience should ask at least 6 months before turning 65 would be, with the plan that I am choosing, are my current physicians covered by that plan? Because if you choose an Advantage plan, all of your physicians might not be within that, quote, network.
Yes, that's absolutely true. So with supplemental insurance, you do not have a network at all. You can see any doctor anywhere in the country as long as they're Medicare approved, which just about everyone is. However, on the Advantage plans, you're limited to a network of doctors that you can see. Over the years, the Advantage plans have allowed you to see a wider range of doctors, which is absolutely fantastic. They've improved those very much over the years, but you do have to watch your network on an Advantage plan. Okay,
so Medicare travels across the country.
Mm-hmm.
Supplemental plans travel across the country with you. Advantage plans, you know, for our snowbirds that might go to Arizona or Florida or North or South Carolina for the winter months, should be a little leery with the Advantage plans, that if something, you know, should happen to them while they're away, you know, the Western Pennsylvania Advantage plans might not carry down into those states.
Correct. That's both true and false.
Okay.
So we have with Advantage plans similar to your private insurance, you have HMO and PPO plans. HMO plans are going to cover all of your doctors locally here in Western Pennsylvania, as well as some out-of-network specialists. Certain carriers cover places like the Cleveland Clinic. However, with the PPO plans, you do have access to a wider range of doctors, even out of state. However, you're going to have higher costs associated with those specific plans. Being on a supplemental plan, you're going to pay the same amount across the board, whether you're a snowbird traveling to Florida or if you're somebody who is just staying here locally. So you do have to be a little bit leery when you're traveling on an Advantage plan.
Okay. So I'm going to get into just a very quick overview of prescription drug costs. Obviously, in choosing a plan, you want to know what your cost will be for what you're taking currently, and you want to make sure that those drugs are on that formulary before you choose that plan, and you want to make sure that they're on the right tier. There's tiers that go 1 through 5, and everyone would think that tier 1 is the best, but could be the most costly, whereas tier 5 is the least costly, but drugs might only be covered under a tier 5.
With your prescription coverage, there are 5 tiers. The way that actually works for your tiered drugs is it's actually the opposite.
Okay.
So tier 1.
That's why you're the expert.
So tier 1 and tier 2 drugs, under most plans, they're typically covered. You're not going to have any type of copay. If you do have a copay, it's very minimal. Once you get into tier 3, 4, and 5, that's when you have higher costs associated with your drugs. So under tier 3 drugs, most plans you're paying upwards of $40 for that particular drug for a 30-day supply. Once you get into tier 4 drugs, you're paying usually around $95 to $100 for the cost of that drug. And on tier 5 drugs, those are our more serious drugs, sometimes experimental drugs. That's where things can get very expensive for people, where you have a 33% copay on a lot of those drugs that you have to pay out of pocket for, which could mean thousands of dollars for a lot of individuals.
Okay. So you also probably want to make sure your plan includes your regular pharmacies that you currently use. If you prefer to get your prescriptions through the mail, you'd want to check that. And you also want to ask your broker or family members that the plan that you're looking at, does it have a good quality rating? So again, prescription drug costs continue to go up. We cannot blame the manufacturers. Medicines are costly, no matter what they are. And in rheumatology, they unfortunately are just as costly as in oncology. So we encourage our patients to look at the manufacturer. If you're not savvy with the computer, have a son, a daughter, a grandson, a granddaughter, a neighbor help you search the web to find out if there are any financial assistance programs for your medications. Again, they are listed on our website under resources. We also have someone here in the office that we keep a list of patients that just cannot afford medications, and we want to heal and care for everyone here. And they reach out to these people at the beginning of the year when funds open up through some of the foundations to try to get them enrolled. Money for the foundations goes very, very quickly. And our staff prides itself on trying to help our patients obtain as much financial assistance as possible. Again, we have 5,000 patients here between the 5 providers, and patience is required when you apply for assistance. We don't know your financial information. You are going to have to provide some financial information. You may have to fill out some of the paperwork yourself, but we will help you and hold your hand through the process and do our best, if it's denied, to appeal and try to get that covered for you. So in closing, I want to thank Cody for coming. Cody, can you please give your information to the audience so that if they want to call and set up an appointment with you, I'm sure they can come to your office or you can meet them at a coffee shop, and he will help you understand your enrollment options. He'll help you plan a timeline to avoid penalties and delays. He'll help you compare the plan options, help you calculate costs per month of premiums, deductibles, co-pays, co-insurance. And he'll also educate you on enrolling in Part A and Part B. And you also want to make sure that you get confirmation receipt of your Medicare card. And about 3 years ago, I want to say, they changed everyone over from using their Social Security card to numeric and alpha.
Correct. They've made changes with Medicare over the years to provide a little bit more privacy with the HIPAA laws, which is fantastic. Once again, I'd like to thank everyone for tuning in to this episode. I'd be happy to educate you and create a personalized plan for you. And you can reach me at 412-992-1169. My philosophy is to keep things very simple because this is a very difficult and time-consuming process for a lot of individuals. I'd be happy to meet you, like Christine said, at a coffee shop, at your house, or even at my office. I'm very easygoing, and I'd be glad to help guide you through this process, as it can be very difficult for a lot of people.
Okay, and Cody's also going to provide us with some of his business cards. So if you have an upcoming appointment and you're unable to view our YouTube channel, we will be able to give you Cody's card and you can discuss it with him at your leisure. Thank you for tuning in to another Catching Up on the Couch. This is a very important forum that we do every year for Open Enrollment. Open Enrollment started when, Cody?
It started on October 15th, and it actually ends on December 7th.
Okay.
So there's not a lot of time left to make a decision, whether that's staying with the carrier that you have and the plan that you have, or looking into getting better coverage.
Okay. So thank you for tuning in. Remember to like us on Facebook. Remember to subscribe to our YouTube channel. Tick the notification button and you will get notification every time a new forum is posted. So for myself and Cody and the physicians and staff here at Advanced Rheumatology, we're signing off and asking you to stay safe and join us again.